Hey guys, ladies. I know it's a little creepy to go from pediatrics then to organ donation uh, but it's not just people donating. We're actually um, transplant, transplanting those organs. So I guess it's kind of like they're getting a new life. So it's not all bad when we talk about transplantation. So obviously, there's lots of different types of transplants, and we talked a little bit about transplantation when we looked at the plastics, the different types of grafts that were moving around on one person, and then we talked a little bit, even when we talked about the cardiac, of the different valves and things that are being transplanted, or orthopedics when you're getting your bone graft. So obviously, you're getting those um, tissues from somewhere. So there are different types of grafts. We're getting the allografts, we're getting the autografts, which of course are from yourself, bioengineered grafts, heterotopic grafts, isografts, orthotopic grafts, and then xenografts. So there's lots of different types of grafts. So make sure that you're familiar with the different types of grafts, so that if your surgeon is asking for grafts, or if you're knowing that someone is being harvested for grafts, you know what's being harvested. Of course, they can take lots of different things. They can take bone marrow, they can take corneas, they can take kidneys, heart valves, skin. There's lots of different types of grafts that can be taken. Obviously, there's different considerations for patients as far as what will they take and what won't they take. That's something that you'd have to deal with as you're talking with families. Um, Blood vessels. There's lots of different things, and of course, most of the organ transplantation organizations have professionals that will come and talk with the families as to whether or not they'll either donate organs, or when it comes time to implanting the organs, they usually have the professionals. Not to say that you don't have some role to play in communicating with those family members, but mostly what you're going to be doing is interacting with those professionals, and trying to coordinate the patients, getting those organs, getting them to the right place. And remember how we talked about making sure that we get them in the right transplant vehicles, transplant containers, and then actually getting them to the right place. Okay. They can be sort of sad depending on what it is that you're doing. Some of the procedures, when you're taking a donor from a person who's been in a traumatic accident. Obviously, if you take the heart, then everybody kind of leaves, and then you're left to harvest the rest of the organs, corneas and things that don't need to be perfused. Obviously, they're going to take those organs that need to maintain perfusion first, and then once those organs are gone, then the anesthesia provider doesn't need to stay, and that's sort of a very sad time in the procedure when they leave. So you just have to be aware of how you feel about that, so that you can take care of the patients, because we want to make sure that we're being respectful of those patients that have given their organs to those patients who are waiting. Okay. Of course, there are other types of transplants. There are living donor transplants. When we talked about that, when they had that mishap with that organ, that there are times when a family member will donate an organ. So you have those living transplants, where you have one person in one room and one person in another room, or one person in one hospital and one person in another hospital, where they're taking the organ out of one person and then taking them and transplanting them right into another organ. Obviously, there are times when, again, those people that are giving up their organs are taking them to somebody. There's a national match that goes into them. So of course you have to make sure that you have plenty of equipment, and a lot of times, again, those organ transplant organizations will bring a lot of the instrumentation, or they'll give you a checklist of what you need to prepare for or have available for them when they come in. Okay. One of the things that you won't have to worry about it as much, but something to be aware of, that there are medications and solutions that need to be added to the field, because of course one of the things that they're going to be battling right away is the response of the recipient, right? Because obviously, even though that organ is necessary for their life, the body doesn't really care. The body's like, something's foreign that's been, unless you get from a twin, you're going to have rejection. So there's going to be a lot of medications and drugs that are being given to the patient to suppress that reaction. And by suppressing that reaction, of course, you're putting the patient at risk for other types of opportunistic infections. So just keep that in mind. Obviously, there's heart transplants, lung transplants, double lung transplants, liver transplants. So, I think they have pancreas here and small intestine. So we're getting very, very sophisticated with the organs that we can transplant, and I believe that the retention rate in the recipients is getting much, much better without all of the sickness and some of the issues that they were having, earlier on with, first of all, acute rejection early on, or organs just quitting. So it's a very interesting, and a lot of OR nurses do that on a full-time basis with these organ transplant organizations, and I know it's a very rewarding job. They fly all over the place and harvest organs, and then participate in transplanting organs. So it's a very viable vocation. Okay, so hope you guys are doing well. I'm going to be trying to get that quiz on. The next test, I believe it's our final coming up. I'll be working on getting that in. Okay, email me. Okay, I'll talk to you guys later. Bye.